Hello, I'm Mrs. Ruth Tlau, Associate Professor, Faculty of Nursing. I'll be talking about the physiological changes in the first stage of labor. Here is the definitions of the labor. Labor is a process whereby the product of conception, the fetus, the placenta and membranes are expelled from uterine cavity through the birth canal after 28 weeks of gestation. It is a series of events that takes place in the genital organs in an effort to expel the viable products of conception out of the womb through the vagina into the outer world. So there are various changes during the first stage of labor. First point, fundal dominance. Uterine contractions starts from the fundus of the uterus, near one of the cornua, spread across and moves downward. Contractions of the fundus are strong and intense and last for longer time. This makes the fundus and the mid-zone remain hard throughout the period of contraction, while the wave of contraction weakens in the lower uterine segments. Second is polarity. Polarity is a term used to describe the neuromuscular harmony that prevails between the two poles or segments of the uterus throughout labor. During its uterine contraction, these two poles act harmoniously. The upper pole contracts strongly and retracts to expel the fetus. The lower pole contracts slightly and dilates to allow expulsion to take place. If polarity is disorganized, then the progress of labor is inhibited. Contraction. Uterine contractions is involuntary, regular, and rhythmic. They are controlled by the nervous system and by endocrine influences. The intensity increases progressively, and the intervals between them gradually diminish from 15 minutes more or less at the beginning of the first stage of labor to 2 or 3 minutes at the end of the first stage of labor. Retraction. As the contractions begins, it will not relax completely, which is called as retraction. Thus, the upper segments of the uterus becomes shorter and thicker, and its cavity diminishes, helping in further contractions and progressive expulsion of the fetus. Formations of upper and lower uterine segment. The upper uterine segment, having been formed from the body of the uterus, is mainly concerned with the contractions and retractions. It is thicker and muscular. The lower uterine segment is formed at the isthmus and the cervix and is about 8 to 10 cm in length. It prepares for distension and dilatations. Functionally, the uterus forms a thick lower layer, a thick upper layer, and thin lower muscular layer. In the formations of upper and lower uterine segments, when the labor begins, the retracted longitudinal fibers in the upper segment pull on the lower segment, causing it to stretch. This is aided by the descending presenting part. Retraction ring. The ridge forms between the upper and the lower uterine segments. This is known as the retraction ring. The physiological ring gradually rises as the upper uterine segment contracts and retracts, and the lower uterine segment thins out to accommodate the descending fetus. Once the cervix is fully dilated and the fetus can leave the uterus, the retraction ring rises no further. Cervical effacement. It is the thinning out of the cervix which is accomplished in the first stage of labor. It is expressed in terms of percentage. When 100% effaced, then it is called as fully effaced cervix. In primary, effacement proceeds with the dilatation of the cervix. In multigravida, both occur simultaneously. When there is cervical effacement, the muscle fibers surrounding the internal os are drawn upwards by the retracted upper segment, causing the cervix to shorten. It then merges into and becomes part of the lower uterine segment. Cervical dilatation. It is a process of enlargement of the external os, which is a tightly closed aperture to an opening large enough to permit the passage of the fetal head. It occurs when the pressure of the well-fitting presenting part is applied from within the uterus. It is expressed in centimeters and ranges from 0 to 10 centimeters. So, as the result of cervical dilatations, operculum, which form the cervical plaque during pregnancy, is lost. It expelled in the form of blood-stained mucoid discharge few hours before, within, or after labor has started. This is due to the ruptured capillaries of the deciduous, where the chorion detaches due to dilatations of the cervix. Formations of forewaters. As the lower uterine segment forms and stretches, the chorion detaches from it and increases intrauterine pressure, causes its loss part of the sac of amniotic fluid to bulge downwards into dilating internal os to the depth of 6 to 12 mm. In case of complete flexion, where the presenting part gets completely fixed, fluids cuts into two compartments. By this separation, forewaters is preventing from getting pressure during contractions, and thus it remains intact. One compartment with fetus and some fluid is called as hindwater, and the other compartment, which is fluid in front of the presenting part, is known as forewaters. Forewater, when ruptured, releases prostaglandins causing uterine contractions. General fluid pressure. General fluid pressure, when the membranes remain intact, the pressure of the uterine contractions is exerted on the fluid, and as the fluid is not compressible, the pressure is equalized throughout the uterus and the fetal body. This is called as general fluid pressure. Rupture of membrane. The optimal physiological time for the membranes to rupture spontaneously is at the end of the first stage of labor, after the cervix becomes fully dilated and no longer supports the back of forewaters. Thank you.